And to give you an idea of how fast this is spreading in the United States, 7 states just today reporting their first cases of the coronavirus. And just since we've been on the air tonight, we've now learned more than half the country now, 27 states with coronavirus. And as the virus makes its way across the nation, how do you tell communities to prepare without creating panic? Here tonight, Deborah Roberts.
Uncertain times driving some to extreme measures. Austin-based Mira Safety says their military-grade gas masks and hazmat suits are in high demand.
Regular people who are looking for ways to protect themselves in case this becomes a much bigger threat.
The reality, we don't need gas masks. We don't need hazmat suits.
Are people going too far to be buying hazmat suits and masks in large quantities?
No one's recommending that people buy respirators, which are those blue masks that you see. Certainly hazmat suits, that is certainly overboard.
When you hear public health officials say, everything's fine, don't panic, I think it runs the risk of being dismissive and actually causing people to panic. It's very important to say, we don't know.
You have this chronic high level of anxiety over, am I going to get infected with coronavirus? You have people going out, trying to stockpile on masks, trying to stockpile on food for months.
We just get dry food and also a lot of frozen food.
The end of the line for the toilet paper and paper towels is right here.
In some parts of the country, endless lines and empty shelves, a new reality.
We're seeing price gouging, things like $100 for a bottle of Purell on Amazon.
Amazon now vowing to crack down on price gougers, blocking sellers' accounts.
This is hysteria. It's only going to make people panic more. Controlling the hysteria with sound communication, with facts, is going to be very important.
About 83% of people who are infected with coronavirus and symptomatic have mild disease or mild illness.
So you could be walking around carrying the virus and not even know it.
I was going to say, should we shake hands? No shaking hands right now.
Exactly.
Dr. Sarah Madad is a pathogens specialist who studies deadly viruses.
How do you think it landed on U.S. soil?
We live in a highly globalized society, so you could have had an individual that has a travel history to one of the epicenters that has traveled here in the United States and that may have started the community transmission.
Scientists now suspect that this coronavirus started to spread in the United States over a month ago.
Were there missteps in the beginning in trying to diagnose this illness, do you think?
I think that it's no secret that we were sort of caught flat-footed here. We should have had testing capabilities and infrastructure in place sooner.
Some experts have said we've probably lost about 3 weeks in terms of our overall preparedness and surveillance.
That led to questions about who is infected.
If everybody panics and everybody starts pointing fingers, Italians, we won't go to the Italian restaurant, or we won't go to the Chinese restaurant, like that is the kind of disruption, suffering that could impact many more people.
That's already happening.
Walks are cold, tables empty, Chinatown deserted.
This restaurant owner in New York City's Chinatown says business is down about 50%.
It's empty. People are very concerned. We understand their feelings, but actually it's hurting us too.
Tell them to move! And yesterday it escalated to this disturbing Facebook video of an Asian man being sprayed with air freshener on a New York City subway. Police investigating it as a hate crime.
It's normal for some people to be scared. It's critically important to be able to respond to a public health crisis based on fact and not fear, and evidence and not emotion.
So various states are, either canceling mass gatherings or doing different things to help reduce the transmission in their particular community.
Just hours ago, the famous South by Southwest Festival, worth more than $300 million to Austin, Texas, canceled.
It's a very sad day for me today because we just had to cancel the Arnold's Classic Sports and Fitness Festival.
Arnold Schwarzenegger postponing his hugely popular annual fitness festival.
We want to keep people safe and we want to keep people healthy.
Your best advice to people who are just right now fearful?
I would say let's ramp down the overall panic that we're all going to die and that this is going to be the next plague, and really focus our attention on our concerns for the very vulnerable among us.
We're all in this together. These outbreaks kind of show us our common humanity, and we really do need to fight them as a species.
Deborah Roberts reporting tonight. And so many of your questions coming in. One of the main questions, when do you get tested for this? Which temperature? 100.4 to at the very least call your doctor and possibly get tested. And so many other questions coming in tonight about pregnant women. How can they protect themselves? If you get the virus once, can you get it again? And how many people here in America might have caught this without even knowing? We'll get to all of that coming up.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.